The Charity Fund in the sphere of support of social and cultural initiatives of Leila Adamyan presents Scientific and Practical Conference: Infertile Marriage and Fertility Restoration Methods. Dear friends, sooner or late, when we speak with you about infertile marriages, we quite often mention infections, tumors, endometriosis, etc. Actually, many reasons may cause infertile marriage. However, let's try to remember what is necessary above all for a long-time wanted child to be born. It's a union of two loving hearts. It's a sexual desire. It's a desire to be together and a desire to continue one's life in his or her children. So the following presentation is devoted to very important and topical issues in the treatment of infertility. However, we very often forget about sexual problems which cause infertility. So I'm very pleased to provide the floor for the following presentation to Victoria Kasyan. It is titled Sexual Disorders in Women, Causes of the Poor Life Quality and Reproductive Problems. The floor is yours. Good day, dear colleagues and dear friends. We will now talk about something that is indispensable for the conception and long-awaited pregnancy. We will also talk about the reasons which may block normal sexual relations. Yes, we will talk about sex. We seem to know all about it. It is discussed extensively by absolutely everyone in our communities, on the internet, in the media, in TV series. Seemingly, we have a lot of information about it and we know everything. But in fact, unfortunately, there is a huge number of myths, including those about female sexuality. For some reason, it is believed that only young women can be sexually appealing before 30 years old, when they are young, beautiful and healthy. If you have already had pregnancy and have given birth, then the anatomy has altered, and it is impossible to obtain full sexual satisfaction. Also, the woman must be tender, careful and patient, never take the initiatives in her hands, and only in this case everything is possible. And the worst thing is that there is a very common myth that for a woman to be healthy, she must have regular sex. The more sex, the better. I'd like to say right away, it is not true. Excuse me, could you be slower, please? People are listening to you with so much attention. Applause, please. But the speed is too fast even for me. We will now clarify why it is so and what's wrong with these myths. Let's look at the problem from the statistics perspective. This was a completely anonymous survey. It was an anonymous question about the frequency of sexual contacts in the past year. We may conduct face-to-face surveys when we ask the question right into the face. How often do you have sexual contacts? You might think that everybody will say every day, or even better, several times a day. But what really happens? See, men and women gave exactly the same answer. The average frequency of sexual contacts is 1, 2, 3 or more times per week. Those who do it every day are not so many. They are only 2 to 3%. So what happens in couples? I remind you Elena Andreeva's lecture, where she nicely told you how long it takes to generate good quality sperm, and how long the maximum intervals between sexual contacts should be for optimal fertility. In fact, married couples, more than a half of married couples, have from 1 to 3 or 4 contacts per week. This is absolutely enough for reproduction of the semen and getting pregnant. And those who do it every day, they are not so numerous. It is a fact. When speaking about the regulation of the sexual function, it should be noted that the sexuality of men and the sexuality of women are two absolutely different things. This is an old picture back from the times of Masters and Johnsons, It was drawn in 1970. It was believed that the sexual process is the same in men and women. The first phase is excitement, then the phase of plateau, then the phase of orgasm, and finally resolution. But today we know that the male sexual function actually looks like this. There are certain issues concerning the age that determine our sexuality. We all know that we get older and our body changes, but what happens in women? In fact, the female sexual function is a circle. It is a vicious circle, which at any second may be bothered by some stimulating factor, either favorable or unfavorable, and the spontaneous sexual desire may occur at any time, but just in the same manner. Psychological and biological factors and other things can also affect that desire. Just imagine a young mother. Her child is crying at night. She gets up several times and goes to his cradle. What are the chances that she will have this spontaneous sexual desire? In the first place, she will probably want to sleep. When we talk about the factors which modulate the sexuality in women, we typically think about hormones. Well, reproductive health is important, nobody's denying that. But look, it's only about a third of all the causes which modulate sexuality in women. Psychological interpersonal factors play a huge and enormous role. The psychological health of a woman depends on the way she communicates with her partner, on good relations and mutual understanding with her partner. So the questions are, if she has a depression, if she has a chronic stress, if she has a chronic fatigue. Socio-cultural factors are also very important, such as religious beliefs, cultural relations, family traditions. We all remember good old Freud, who said that our sexual problems mostly originate from our childhood. They are stipulated by how parents treat each other, how they behave with the child. We more and more often see our children living in a virtual reality. They do not communicate with their peers in reality. So sometimes we see girls growing into cold snow queens, and nobody knows how to approach them. Or it could be the other extreme, when there is an extremely frivolous behavior and exhibitionism. This should be treated very carefully. We all remember that, for example, in this religious scheme, everything will be completely different. They have a different approach. They also have very different relations in the family. So, if we exaggerate a bit, sexuality may be shown as follows. There is a male sexuality and there is a female sexuality. She has to think about several things at the same time. What does she look like? Do her partner like her? Has she turned off the iron? And so on and so forth. Yes, we women are very complicated. We are trying to analyze all the things at the same time. As for the types of female sexual dysfunctions, the first thing is reduced libido or no desire. Interrupted excitement, interrupted orgasm. Most often these areas are discussed by sexologists, so we're not going to touch upon them today. Obstetricians, gynecologists are more concerned about pain during sex, so-called dyspareunia or pain during sexual intercourse. How often do we see this happen in our practice? Look, the peak of low libido is at the average age. Let's remember the midlife crisis. We think about what we have done by this age, what we have already achieved, whether we're satisfied or not with the current situation, and the psychological problems, like twins, like Siamese twins, affect the sexual functions too. We're always talking about a low quality of life. An unsatisfied couple will often quarrel, so we discuss sex-related infertility problems, because without sex there is no conception and no pregnancy. A sexual dysfunction is a failure due to pains or due to unwillingness, which cause problems for a couple, thus further aggravating stress, neurosis, and depressive relationships, even up to divorce. And we live in the conditions of demographic crisis, as we all know about it. There are special causes too. In our country, unfortunately, the start of the sexual life is too early. Girls start living sexual life very early. But that means very serious problems which girls have to decide at a very young age, such as an unplanned pregnancy, because no one thinks about contraception. But even the first sexual intercourse may result in pregnancy. So problems occur at childbirth and pregnancy in young girls, when a young and fragile body is entrusted with such a responsibility. Most often the solution is an abortion, but then we deal with the problems of infertility because of inflammatory processes or damage to the endometrium in the uterine cavity. A huge number of inflammatory processes occur because people don't think about themselves or about their own health. So what? It's just a little cold. So what? It's just some infection. But again, This will be mirrored later, when difficulties arise during the realization of the reproductive function. There are a lot of psychological violence-related problems. Again, this happens to very young girls. Sex during pregnancy. It is the most frequent question which is posed to an obstetrician gynecologist. It is possible, but only there is no threat of interruption of the pregnancy, only if the pregnancy is normal, provided that everything is fine for the loving couple. Sex during menstruation should be like this and only like this, and never otherwise. Because during the menstrual period, the doors for infection are wide open. People really want to receive pleasure, but again, unfortunately, the payment will be the health of the uterus, including the patency of the fallopian tubes and so on. Some people like non-traditional sex. Of course, each couple decides for itself in different ways, but allow me to remind you of the infections that are transmitted sexually. Infections don't care where they're gonna get, to the vaginal mucosa or to the rectum mucosa. We see the same clinical manifestations of inflammatory infections diseases. When we discuss the causes of sexual dysfunction in men, we often talk about a complex approach. The problems are very likely to be vascular factors, high blood pressure, atherosclerosis, comorbidities such as diabetes. But we mostly talk about sex hormones. It is very important for men. When we talk about women, the first thing that we think about is psychological health in her relationships. Because a woman is like a barometer of such psychological relationships in a loving couple. It affects her health. Please take a look at the lower picture. We always ask the question, what do our patients do for treatment? We ask about medicinal products. Currently, there are a lot of biologically active supplements imported from various countries. It is sometimes even impossible to read the instructions written in a foreign language. So, medicinal products that our patients take may also affect their health, and we are not always able to find the root cause of the problem. Drugs, smoking, and so on. They have a pronounced impact on health, especially on the sexual function. Let's remember that. To find out the cause of the sexual dysfunction, we, the gynecologist, have to consider a huge number of factors. That's what we started talking about in the very beginning. They are biological causes or some comorbidities, chronic diseases, injuries of the pelvis floor, prolapse, descent of the vaginal walls, pains during the sexual intercourse for various reasons. We'll talk about it in a moment. Incontinence of urine. And because of the presence of some disease, the woman may just avoid having sex. Or she may just not want it, just because she is reluctant. But look at psychological, social factors, self-esteem, depression. What's going on in her life? How well is she self-actualized in her everyday life? Or is she successful at work? Or is she successful only as a housewife? And so on and so forth. We, the doctors, must ask such questions. Usually, the simple phrase, such as, "I'm no longer interested in sex," provides a large area for discussion. And the question that we ask is, does it really bother you? For example, a young woman who is planning a thesis defense or a dissertation defense, will she think about sex? She'll say, "No, I have other things to do right now." Then it's not a female sexual dysfunction. Her low libido is temporary. It's another question if she says, "Yes, I'm very concerned about that, and I began seeing the difference. With this problem, I have come to you." And then we start discussing all the comorbidities. Presence of pathologies. I'd like to draw your attention to anemia. Because when there is anemia, a person feels weakness and fatigue. She has a very low threshold of endurance, physical activity, and so on and so forth. Again, we ask what drugs the patient takes. And again, most of the slide focuses on relationships, feelings, conflicts, stresses, and so on and so forth. We get a vast amount of information from just a regular physical or gynecological examination. Just by looking at a woman, we can already suspect dryness in the vagina, pain during sexual intercourse due to the lack of sex hormones, presence of inflammatory processes. It gives us a large amount of information for proper diagnosing and finding a good approach. Going back to the myth that sex is only for young people. Look, here's the frequency of female sexual dysfunctions depending on age. Practically, it is the same for everyone, both at a young age and at a later age, because sexuality is regulated not only by sex hormones, as it is widely believed. What does the World Health Organization tell us? Take a look. A huge contribution to the reproductive health is made by the presence of sexual relations without the threat of sexually transmitted diseases and a guarantee of safe pregnancy, birth and survival, health of the child. The goal of sexual health is to improve life and interpersonal relationships. So it's not only consultations with doctors and treatment related to reproduction and sexually transmitted infections. This is quite a complicated slide. I'd like to show you here what number of hormones and biogenic amines of various substances play a role in the central regulation of our sexual function. In addition to sex hormones, estrogens, testosterones, a vital role is played by the hormones of happiness, which is known to us such as dopamine and serotonin. We all know about the effect of the antidepressants, which increase the level of these hormones of happiness, and we always want to find some magic pill for sex. There are a lot of such pills for men, I'm not going to tell you their names, and we always want to find some kind of magic pill for the regulation of female sexuality in women too. Today, there are, unfortunately, a lot of speculations about the use of male sex hormones, testosterone in women. I just wanted to say that we can use it with a very limited number of patients, because as of today, there have been too few studies conducted. They all have been very short-term, and we do not yet know the side effects, such as undesirable hair growing and other manifestations of excessive male hormones, up to a catastrophic rise in the mass of muscles, virilization or masculinization. And friends, most importantly, we have not yet answered the question about the impact of testosterone on the mammary gland and breast cancer. Therefore, regarding testosterone, though we really love it, we are very careful about it. And the clinical recommendations which regulate the work of doctors say the same thing. Have a look. Before starting a therapy with testosterone, it is necessary to detect and eliminate various factors, such as dyspareunia, depression, side effects of medication, relationships with partners, and other health problems. So even here, we, the experts, are told that we must take into account the mental and psychological problems in our patients. Therefore, a couple must have a dialogue, but it must not be a unilateral dialogue leading to quarrels with one another. It must be a real dialogue, and building a dialogue to resolve a conflict between two loving hearts. Now, a few words about chronic pelvic pains. This pain is not associated with menstruation, it is localized in the pelvic area, and it is so strong that it disrupts the normal way of living. It lasts for at least 3 months, and often longer, and it really disrupts the daily living and activity of women, which requires consultation with a doctor and prescription of a therapy, and often a surgical treatment. How often do we see it happen? Its frequency is from 4 to 16%. Unfortunately, only a third of patients go to a doctor for medical help. Others are trying to cope with it at home using some folk remedies, using their own possible methods. Unfortunately, it is not always successful. Most often, we need operative methods of treatment for determining the correct diagnosis. I'd like to remind you that up to 60% of all patients with chronic pelvic pain may not have an accurate diagnosis for years, going from one specialist to another. The chronic pelvic pain is an indication in up to 40% of cases for gynecological surgeries, and in up to 20% of cases for operations with the removal of the uterus. Well, pain can be silenced with folk methods, but it's better to consult a doctor to determine a proper diagnosis and find the exact mechanism with the help of which we can relieve the patient from pain and improve her sexual function. For some reason, we always think that a chronic pelvic pain is a 100% gynecological problem. But I'd like to note that problems of the gastrointestinal tract play the leading role here. They are diseases in the intestines. In the second place, we have urological problems, and gynecological problems are only in the third place. They are detected only in 20% of women. In other words, 1 in 5 women with a chronic pelvic pain will have some gynecological disease. Most probably, we will recommend doing a laparoscopy for determining the diagnosis, but in 35% of cases, we will not see anything, there won't be any adhesions. But in each third patient, we will find an external genital endometriosis. It is a growth of a tissue which resembles endometrium. It means some inflammatory processes which cause the growth of this tissue with the formation of adhesions. Therefore, the anatomical processes per se will result in infertility and sexual dysfunction for these reasons. And these adhesions happening due to inflammatory processes can also be detected and eliminated only with the help of laparoscopy. It is not possible to see the adhesions in another way. Endometriosis is a disease of the 20th and 21st centuries. I'd like to draw your attention to the fact that endometriosis causes pain in the first place. Up to 70% of women complain about abdominal pain, 75% complain about pain during a sexual intercourse. Menstruations become painful in almost all patients, and each second woman comes to the doctor with complaints about infertility. The metastasis of endometriosis may be to a various degree, from several foci to 2 adhesions to a rather bad situation. And the qualification of the surgeon who will do the surgery is very important, because the surgeon must carefully remove the endometriotic cyst without damaging the ovaries, correctly eliminate adhesions, and remove the cause of the chronic pelvic pain, which causes inter alia female sexual dysfunction. Infectious inflammatory diseases are of great importance too. A chronic pelvic pain may be due to adhesions. Unless we do a laparoscopy and eliminate adhesions, we cannot cure a woman from that. Mass media often imposes new standards of beauty. Everyone must be very thin, very slim, like supermodels. But the lack of weight is almost always equal to a shutdown of the ovarian function, because the body has very uncomfortable conditions for pregnancy and childbirth. It does not have the required base, there is no protection, nothing for building a child, because the reproductive system is practically dormant. It does not synthesize female hormones. We remember the physiological period in women's life when female sex hormones are no longer generated, the menopause. The doctor of the past, Avicenna, said that old age always means dryness. We know that older women have dry skin, they have wrinkles. The same thing happens at a young age when the woman is underweight, she has a nervous anorexia. The genital organs become so dry that it becomes impossible to live a sexual life. Another frequent reason is a syndrome of a venous plethora in the pelvis, when a woman complains about pain after sexual intercourse. We know what pain in the legs a person may have if there is varicosity. Legs feel very heavy, it is very difficult to walk, especially in the evening. The same situation happens if there is varicosity in the pelvis. A very specific symptom is pain after sexual intercourse, which occurs due to this venous plethora. There are a lot of various medicines with which we are trying to cure sexual dysfunctions. We use certain sex hormones depending on the case, but with some reservations. We must avoid certain antidepressants because there are some drugs that cure the depression, but they may cause inter alia a decrease in the sexual functions as one of the side effects. For example, phosphodiesterase inhibitor type 5, the blue magic pill. It is proved by studies conducted in women. Some new drugs are being developed for treating female sexual dysfunction. We have new methods, for example, laser treatment. It is a laser rejuvenation of the vagina used when there is an atrophy of the vaginal mucosa. It is used at the first stages of the prolapse in the pelvic organs. So we can help women this way if they have already given birth to a child, if they only have the first stages of the prolapse of the vagina. Using laser methods, we can restore the usefulness of the vagina and normal intercourse. That is why female sexual dysfunction is a very hard and complex problem. Quite often gynecologists turn to their colleagues for advice, sexologists, psychotherapists and other specialists, to help women to cope with their sexual dysfunction. Yes, women are very complex. I guess life is much easier for men. But things are strongly interrelated, such as the mood of a woman and her sexuality, her general health and reproduction. And if all the components are fine, then we can get our desired pregnancy. Therefore, take care of each other, be careful with each other, talk to each other, do not be angry with each other, and we're always ready to lend a helping hand in our clinics and to deal with almost any problem to help you to get the long-awaited and desired pregnancy. Thank you for your attention. See you at the next conferences of the Open University of Leila Adamyan.